So I want to leap right in and introduce our panelists. But before we do that, just to frame our discussion for tonight, it's not just about storytelling. We're going to be talking about reproductive health during these strange and surreal times. If you discover that you need an abortion while you're quarantined, it's unclear if, for some people, whether clinics are open. What do we do if we're told to stay at home? And how do we manage risk? Under these circumstances, how does one access abortion? Not to mention that some states are using the pandemic to deem abortion non-essential and restrict people's access to getting the care they need. And a lot of people still aren't very clear about what their options are with regard to medication abortion care. So we're going to touch upon all of those things and more as we talk about this important issue, and also how do we translate that into narratives that can help move the conversation forward for all of us collectively. We have a great group of panelists with us tonight, and I'm going to ask each of them just to wave and say hello when I introduce them. First off, we have ELIZA HITTMAN, who's award-winning screenwriter, director, and producer of the film Never, Rarely, Sometimes, Always, Beach Rats, and It Felt Like Love. ELIZA, will you say hello to everyone?
Hello, thank you for having me.
Thanks for joining us. We have Liz Winstead, the co-creator, Daily Show, and co-founder of Abortion Access Front. Hello, Liz.
Hi, guys. Thanks for having me.
Thanks for being with us. We have Dr. Bhavik Kumar, who is a family medicine doctor who provides abortion care in Texas, one of the most restrictive states in the Republic. Doctor, say hello to everyone.
Hi, everyone. Thanks for being here.
And finally, we have Lydia Zakel, who is a storyteller from Indiana, who had an abortion using medication when she was just a junior in college. Her story has been told in People magazine, and she's going to tell us a little bit about her story tonight. Will you say hello to everyone, Lydia?
Hi, everyone. Thanks for having me.
Lydia, let's jump into things with your story. Can you tell us a little bit about your background, family, and support system, and the time frame in which you experienced an unintended pregnancy?
Of course. I was thinking about starting this with just going into the story, making it feel like y'all were actually there with me. So hopefully I can put you in that moment. But I'd like to start off by saying that this is just my story, and everybody I know experiences a very different story. So while mine may be familiar to others, I understand if you don't have the same experience or feelings as I did too. I was a junior in college when I found out I was pregnant for the first time. I was 20 years old, and I didn't think I could ever be pregnant, honestly. The thought never occurred to me, so I was very unprepared for what was about to happen in my life. So I was living in my sorority house, which was a Lutheran sorority. So we were all living together, and everyone started getting their periods at the same time. And as each person got their period, the next day I was like, I guess I'm the last person in my house to get my period. But then a month passed and it never happened. So after a month and a half or so, I realized that my breast started to hurt all the time. So I initially thought I had breast cancer, of course. So I went to my primary physician on campus at our health center at the university. And she was like, no, you don't have breast cancer. Let's figure out what you have. So she did some tests, and she's like, you're just pregnant, that's it. So in the 60 seconds that I found out my test results to making a decision, she handed me a bunch of brochures and pamphlets on adoption and on parenting and all these other helpful information for other people, but not for me, on how to raise a child or how to give birth. And my initial response was, oh, do you have the number for my local abortion provider or for Planned Parenthood? Because that's what I need. And she's like, oh, are you sure you don't want to look through these pamphlets or brochures first? I was like, yeah, no, I'm pretty sure I know what I want. So my experience was it took me 60 seconds to make my decision. on what I wanted. And I think I knew that like internally before and always. So she gave me the number of Planned Parenthood as well as the other brochures and pamphlets. And I went back to my house and I called Planned Parenthood. Then being on the phone with them for a while, I don't want to give it a time period because I'm not sure if it was like an hour, but it was around there. I finally got to speak to somebody, and the person on the other side of the phone was like really responsive and receptive and everything. And she was like, how can I help you today? And I was explaining the whole situation to her. And she's like, okay, do you want the medical abortion or the surgical abortion? And I was like, I didn't know there were more than one option. So she explained them to me on the phone in great detail. And she even told me like what my insurance would cover for how much for each one. And so it was super helpful. So it was like, okay, I'll have the medical abortion then. So all within like that hour and a half time, all my decisions were made. That's what happened in that entire hour and a half. So then after that, we scheduled the appointment. Unfortunately though, I was like 7 or 8 weeks along, and the next appointment would be 3 to 4 weeks later. So, and the only available appointment was the week of Thanksgiving, which lucky for me, I had the entire week off of classes. So I didn't have to worry about anything else conflicting with my schedule then. But in Indiana, I'm from Indiana, we have this law which has us have 2 appointments that are over 48 hours apart from each other. So I had to have a Tuesday and a Thursday appointment scheduled for the week of Thanksgiving. So as the weeks passed by, my friends were all super supportive. They were so excited for me. They're just like, yeah, we get to eat all the time and you have excuse to eat at every Indian buffet. It was awesome. But then finally, the day of came, the first day, where I went to the Planned Parenthood, and of course there were protesters there. But I went inside, I waited for a while, and then my first appointment was an ultrasound, where the doctor who took me in had to take a picture of the fetus. And then she asked me if I wanted to keep a picture of it. And I was like, I don't know, sure. So she gave it to me. And then after that, I met with the doctor and she went over this entire laminated sheet of different items that she had to cover with me. And after each item, she's like, this isn't statistically true or proven, and here's some facts to back that up, but I have to cover it with you, and so forth. So she was super helpful and funny and nice and amazing. And then she left me with her information to contact if I had any questions. And then I waited the next day. And then I came back on Thursday where there were even more protesters. And my friends and I were planning a Friendsgiving. So they were all getting ready what we were going to eat for dinner. So like turkey and mashed potatoes and everything. And I was like getting ready to go have an abortion. So I went to Planned Parenthood that day. All my friends offered to drive me, but I was like, no, I kind of just want to go alone and just like make it not a thing. So I went there, and at Planned Parenthood, there was 3 other women in the waiting room with me at our 8 a.m. appointment. And the doctor called the 4 of us back, and we just sat in this like room with these chairs that had heating pads on them, and then like pads on the chairs themselves. And it was silent and it was awkward. And a nurse came in and she brought a radio and turned on Adele to play. And the nurse started singing to Adele's Hello, which came out like that week. And the rest of us just sat there in silence awkwardly. And then the doctor called each of us back one by one. So I don't know what happened to the other woman, but when it was my turn, she gave me a cup of water and the first pill. And I took the first pill with her. And then she gave me a bag that was a brown paper bag that was full of like her contact information, the phone number to call for 24-hour questions if I ever had anything come up, the second pill, pain relievers, and lots of pads. So after she went over all the information with me, she asked me if I had any questions again, and I didn't. So I then went home. And I was leaving the clinic that day. Of course, there were more protesters. But the woman who escorted me back to my car, I asked her if I could become an escort that day and volunteer. And she said yes. So for the past 5 years, I've been volunteering and escorting with her. And then I went to my Friendsgiving with all my friends, and we had a lot of food. I didn't know if I could drink wine, and I didn't want to call the 24-hour number and ask them because I felt like it was a really stupid question. It was like, I don't know if it's going to affect the pill that I need to take. So I just didn't drink. But then I went home from Friendsgiving, and all my roommates had left for Thanksgiving with their families. So I was home alone, and it felt super comfortable. I got to turn up the heat to the house to 75 degrees, and I got to like get under all my little warm comforters and like 3 different comforters. And then I followed the instructions and took the second pill, and I played Hotel Rwanda on Netflix because I was an international studies major and a nerd. And then I just waited. And the most surprising thing was I didn't know what to expect. I was like more scared about what to expect than actually having to go through the process. But what it was just cramps that were like a pretty bad period and nothing more. So I just like laid in my bathtub while the shower water rained down on me as my cramps passed. And then I woke up the next morning and had Thanksgiving with my parents. So that was my experience. And my friends were super supportive throughout the whole time. I think that's one of the luckiest things I had about the entire experience, was having super supportive friends. And then afterwards, when I told my family, they were all very supportive too. Well, my mother used to work for Planned Parenthood, so of course she would be supportive, I guess.
Thank you so much, Lydia, for sharing your story. And of course, there are all sorts of different stories that women have in terms of their experiences, whether it's a medication, abortion, or a procedure. And ELIZA, I want to come to you in a moment because you, with incredible artistic and empathetic detail, told the story of a young woman who was seeking an abortion, and I want to get to that. But before we do, while we're on the topic of medication abortion, we want to try our first poll here. Now, this is a relatively new thing for these panels, so bear with us as we make sure we get the technical side of it right. I'm going to ask a question, and polls, I think, going to pop up on your screens, and we're really curious to hear what your answers are to this poll question. Then we'll come back with some of the facts a little bit later on in the panel. So the first audience poll is this. How many of you are aware that there is an option for women to have an abortion using pills? And how many of you know it's a different thing than Plan B? So that just popped up on my screen, which means it should pop up on yours. Please participate in the poll, and we'll come back to the results and some of the facts in a few minutes. ELIZA, before we get to you, I want to get a little bit of a lay of the land. Dr. Kumar, you're on the front lines in Texas. Can you tell us a little bit, I mean, just in terms of your perspective of women, who are managing their reproductive health, but also particularly how things are different right now, at least in your state and your experience, given the pandemic?
Yeah, sure. So Texas is one of the most restrictive states when it comes to abortions. And so it was surprising, but also not surprising, that they took advantage of the pandemic to take advantage of people and try to outright ban abortions. And so unfortunately, in the state of Texas, we essentially had no access to abortion for about 3 or 4 weeks, which meant a lot of people had to travel out of state. We heard back from some patients that traveled as far as Colorado. Some folks went to Chicago, and there may have been other folks that traveled further than that. And of course, this whole time, we could have provided care very safely within our own communities. And we're having all of this happen during the pandemic, and we're hearing from other folks in states like New York and California, where they've been able to be more innovative and start providing abortion care via telemedicine. Some states have been able to provide curbside abortion, especially for medication abortion, where folks can drive up, get their medications, and drive home, as long as they qualify for that care. But unfortunately, in states like Texas and many other states in the South and the Midwest, a lot of these options just aren't available.
Thank you. Access is an important topic when we're talking about reproductive health. And ELIZA, in your film, one of the chief conflicts that the protagonist is facing is having to leave her state, Pennsylvania, to go to New York in order to get the care that she needs. There are some similarities with Lydia's story, of course, the very, sort of eerie scene where she's seeking some counsel initially, and I believe at one of the many thousands of crisis pregnancy centers that exist around this country, and eventually she gets the help she needs. One of the things I was struck so much by is, as Lydia discussed, the knowledge of knowing what she wants to do is not the question. It's really a matter of access. And in some of my own research, I know that the vast majority of women, it's not a question of whether to get the abortion, it's how do I get the abortion. And you did such an amazing job at portraying that. I was wondering if you could just talk to us a little bit about access, about the research you did for the film, and why you felt it was important to tell this particular aspect of the story.
Mm-hmm. Initially, I began thinking about this film in 2012 when this woman in Ireland tragically died, Savita Halappanavar, after being denied a life-saving abortion. And I just started thinking about, like, well, how far would this woman have had to travel to save her own life? And thinking about the journey that many women would take from Ireland to London and back in one day. And I really thought it was a very compelling, hero's journey that takes so much persistence to overcome all of these, distressing obstacles in order to be able to access safe reproductive care. And I thought, why haven't I seen that movie before? So I just began to think about that idea of this hero's journey, but in the United States. And I talked initially to some people at Planned Parenthood and other clinics, a private clinic, independently run clinic called Choices in Queens, and just tried to understand where women were coming from and why when they traveled specifically to New York City. And there were a lot of arrows that pointed just to Pennsylvania because of the intricate state restrictions that exist, at this current moment. So I opted to explore Never, Rarely, Sometimes, Always through the lens of a minor who, doesn't want to seek parental consent in order to have an abortion. And I did a lot of research. I went to a lot of those pregnancy care centers, and I took pregnancy tests, and I just kept asking myself, like, why is there?
I'm sorry to interrupt, but just for some of our viewers that might not be aware of what crisis pregnancy centers are, could you give a brief description?
Yeah, there's one in almost every town in America, and they are volunteer-run centers that provide, store-bought pregnancy tests and quote counseling, which means that they essentially give, false information about the safety of abortions and try and steer people to adoption clinics. And they offer, they have hand-me-downs and, donations to help, to help women make the transition into motherhood. But they do offer some medical services that they're actually not licensed to provide, and they're deeply unethical, but yet somehow manage to be federally subsidized.
They're very much a product of the anti-abortion movement,
yeah.
and often strategically set up close to legit clinics in the hopes that people will actually mistakenly go to the
Yeah.
wrong place that are seeking an abortion. They'll steer them away from it.
Yeah, and they're known for preying on vulnerable young people, I would say. So for the research of the film, my goal was to, walk through the narrative from the point of view of a minor as much as I possibly could. So I went into those places and I signed in, and I was also given a bag full of pamphlets like the character in the movie and like you had also received. And they were like hand printed, printed pamphlets, handmade. And I took pregnancy tests and went through those counseling experiences, which are very much depicted in the film. And then, on the flip side, I consulted with Planned Parenthood and other clinics and met with social workers and, tried to ground the film as much as possible in credibility and the real obstacles that, a young person from this specific state would encounter.
Can you tell us a little bit about the response to the film? I mean, it's critically acclaimed, you've won awards, but in terms of real people who have encountered this film and what it's meant to them, or some of the backlash you may have gotten from the anti-abortion movement?
Well, the release of the film was curtailed by the pandemic. So I haven't had as much contact with audiences as I would have hoped for, but my inbox and my DM inbox is full of people who are sharing personal stories. In terms of backlash, there has been a lot of things that I'm tracking online where people are trying to drive the ratings down of the film, people who are anti-abortion. So that's the retaliatory strategy at the moment of conservative audiences who, haven't watched the movie but want to tear it down regardless.
And for all our viewers, if you want to watch the movie, it's available on Amazon as of today, right? And it's really extraordinary, and I encourage you all to see it.
I think it's available to purchase now. Before it was to rent. I don't know, something like that. But yeah.
One way or another, find the movie.
Yeah.
And it's well worth it. Liz, you are such a wealth of information, not only as a storyteller but as an advocate. And I'm wondering if you can give us a bit of lay of the land on the advocacy front. What are the challenges that we faced prior to the pandemic, and now several months into it, some of the new challenges that are on your peers' plates?
Oh my gosh, so many. First of all, I want to say that if you want to learn more about fake clinics, we have a website called exposefakeclinics.com that Abortion Access Front started, that has tracked thousands of these clinics and really goes into what they do and really goes into how you can advocate to really get the word out about who they are and what they do. Pre-pandemic, access was already horrifying, with the way clinics have been closing at alarming rates. My organization travels around the country and teams up with local activists, and we do comedy and music shows, and then we have conversations afterwards with the providers and the activists in that town so that our audiences can really learn about what's at stake on a state and local level, and they can connect with the providers and sign up right there. So pandemic-wise, obviously we aren't traveling, but the good news is, because my organization was started by people from the entertainment industry who were like, screw it, we just want to use our power to try to raise awareness around this issue, we were able to pivot pretty quickly. And so during the pandemic, we started a mutual aid program, and we've worked with over 100 clinics to make sure that PPE, to make sure that the health and well-being of the providers is met. We just did a telethon and raised $127,000 for independent providers who want to be able to pay their staff if they have to furlough, or take time off if they've been exposed to COVID. A lot of physicians in states have to fly to different states to provide. And if you can't travel, that makes it that much harder, you know? So we've been doing things like patients have had to now wait inside cars a lot because you want to keep social distancing within waiting rooms. So we've been helping clinics get those restaurant access things where, you know, the beeper goes off and then it's time to go in to your appointment, because people, you know, when we look at where people are, you want to meet them where you live, and not everyone has a cell phone that works, and not every place that there is a clinic has great cell phone areas. And so it's been very difficult. And so we've also just been really wanting to remind folks that abortion providers are essential workers. And when they try to use all of this rhetoric and language like abortion's elective, guess what? All surgery is elective. Nobody gets to just give you a heart transplant because, you know, you have to sign a paper. So elective and essential can mean the same thing. And so to understand that abortion providers are frontline workers, to understand and really make that connection that a lot of these clinics who are small businesses that provide care aren't getting these small business loans because the government is garbage. And so we've really been trying to really raise awareness on that front, and really from a virtual standpoint, be able to work with local people on the ground who can safely deliver goods. And those goods, you know, keeping people's morale up, keeping people's spirits up, and keeping workers happy and healthy is important. So we do everything from trying to get people medical stuff to providing them with, you know, Starbucks cards, and just like home facial care and things like that. Because it's just important that we constantly are reminding people who provide the care that they are seen and they are heard and that they are worthy.
What has your organization been doing on the political front to combat this, you know, quote unquote, non-essential status and the exploitation of the pandemic to curtail reproductive rights? And what do you advise for people that align with your point of view, things that the average person can do to help on that political struggle?
Well, there's been a couple of things that we've been doing. We've been working with advocates of Planned Parenthood, for example. We had a 250,000 person petition delivered to Congress when Title X funding is a very important thing, which is the people who are very, very low income, who need Title X funding to go to clinics so they can get wellness visits. The Trump administration has decided that Title X funding shouldn't go to people who provide abortion care. And that is ridiculous, because when you look at Planned Parenthoods who are massive providers of all kinds of care, but also massive recipients of Title X care, so they can really expand those services, when they're being shut out of being able to provide essential care to folks, we really are saying to Congress, hey, if you're not going to provide Title X funding for these clinics, then don't fund Title X. Do not fund Title X until Planned Parenthood and other comprehensive healthcare services get it. And they're diverting the funds that go to healthcare providers to these fake clinics we were just talking about, so they can give people wackadoodle information that is based in religion and judgment and not in science. So that's one thing we've been doing. We also just, quite frankly, like to expose and shame politicians who are anti-abortion and anti-choice in a way that we can. So every year, our political arm does an award show called the Golden Probe Awards, where we have a massive award show where we have categories like Best Original Science, Best Acting Like You Care About Women in a Non-Supportive Role, and we use clips of their actual words as categories and as nominees, and it's really, really fun. And so, you know, we're just out there constantly just trying to destigmatize and put abortion into the conversation where it needs to be, which is one of a panoply of reproductive health care needs somebody might need in their lifetime. Boom.
Great, thank you. Now, because it's my first time moderating while we conducted a poll, I don't know if there's a way for our results to pop up or to be shared. But let's see if they're coming up right now. How many of you are aware that there's an option for women to have an abortion using pills? 85% were aware. How many of you know it's a different thing than Plan B? I was not aware they were different, 13%. I did not know there was an option to have an abortion using pills, 11%. And I'm aware they're two separate things, 75%. So that's good that 3 out of 4 people, you know, on this, you know, tuning into this, actually knew that there was a difference. but also keep in mind that this is a self-selecting group of people who have access to a Hollywood Health and Society panel, and I imagine those numbers are probably a lot lower for the general public. Dr. Kumar, can you for the significant portion of our audience who wasn't aware that there's a difference, can you tell us the difference, and also maybe give us a little more insight into what are the common misconceptions people have about their medical options when they're seeking to terminate a pregnancy?
Sure. So Plan B is a high dose of a medication, which is essentially a type of progesterone. And the way Plan B works is it stops the pregnancy before it's even formed or implanted. Medication abortion, which involves a medication called mifepristone, it ends a pregnancy that's already started. So there are two different medications that work in two different ways. And medication abortion care involves mifepristone, which is the first pill that Lydia talked about that she took in the clinic. And then there's a number of other pills that you can take 24 to 48 hours later that helps your body expel the pregnancy. Some of the common things that I hear from patients, and just seeing some patients today, folks will ask things about their fertility and their future pregnancies. That tends to be one of the main concerns. Will these medications affect my fertility? Will I be able to become pregnant again? And the medications that we use for medication abortion care have no effect on your fertility. Folks can become pregnant within a few weeks afterwards. There's not like a delay or waiting period. Fertility goes back to the way it was before pretty quickly. A lot of folks ask about concerns with pain, discomfort, and bleeding. And like Lydia mentioned, it tends to be somewhat crampy, kind of like a period, but a little bit more intense, and the bleeding tends to be a little bit more intense. And then some folks occasionally ask about the medications causing harm to their internal organs, or they've heard something about, the medications burning something on the inside. And typically, this is information that folks have gotten from the internet, Googling things from anti-abortion websites, or perhaps they've gone to a crisis pregnancy center where there's a lot of misinformation. They may have heard things that just clearly don't happen. And so we spend a good amount of time with some patients talking about what misinformation is out there, how there's no harm to your body, there's no way the medications can damage your body or your internal organs, and why a lot of that misinformation is out there, and why folks try to perpetuate that. And so the bottom line is the medications are safe, it's super effective, and we often have to say that over and over again just to sort of overcome a lot of that misinformation that they've heard beforehand.
Now, a number of states do have restrictions on even medication abortions, but in the age of COVID, is this an option that is perhaps at least a partial solution for the difficulty of travel if you don't have a clinic near you, or states that are exploiting the pandemic to restrict reproductive health in other ways?
It should be, right? And so, states like Texas, and again, states in the South and the Midwest have a number of restrictions. So where I work in Texas, we have a mandatory delay of 24 hours. Lydia mentioned in Indiana, it's a mandatory delay of 48 hours. There are requirements in some states that only physicians can dispense medications or provide abortions, required scripts with misinformation, required ultrasounds, viewing of the ultrasounds, required number of visits. So in Texas, you have to have at least 3 in-person visits in order to receive the medication. But we've always known that a lot of this, if not all of it, is absolutely medically unnecessary. There's no reason for me as a physician to say this rule makes sense, or a person should have to go through this requirement. And so what the COVID-19 pandemic has done is it's really highlighted a lot of this stuff where we know people don't need to come in to the clinic 3 times for medication abortion. They could easily access this some other way. There are a lot of folks that would qualify via telemedicine. We can ask them questions and get that information over the phone, over video conferencing or telehealth. There's a lot of folks that don't need an in-person exam or perhaps even an ultrasound in order to get the medications. And so some states that are in more liberal places have been able to take advantage of innovations during the pandemic. Again, New York, some health centers have been able to provide curbside abortion where folks that qualify, they can drive through, they can get their medications, they can go home and take them. But in large swaths of the country, that's simply not possible. And, we've tried to, tell the state why these things are not necessary, why these things are actually harmful for people. And again, especially during the pandemic, we don't need to see people in person a lot of the times. We don't need to have them come back for 2 visits. We don't need to have them wait 24 hours, 48 hours, or 72 hours, or whatever the state's requiring. But they are holding down on their rules and their regulations that are specifically targeted towards abortion, and unfortunately just making it even more difficult during a time when we should be making it easier for people.
And could I add, there's a great op-ed in the New York Times over the weekend from an organization called Plan C that are really advocating for telemedicine and really trying to do that. So, I mean, they're really great, and this op-ed was fantastic. So if you can pop that in the comments, it's really, really just lays out a lot of why, also why medication abortion has been put into this funky FDA regulation that doesn't make it as accessible as it needs to be. And it kind of lays out a lot of the wonky stuff in really good plain English. So.
Great, thank you, Liz. One more medical question before we steer it towards storytelling. Dr. Kumar, are you facing any people that have hesitations about going physically to clinics for fear of infection or being in any sort of medical environment? Is that something that you've been facing since the pandemic is descended upon us?
Yeah, I would say a lot of folks are appropriately concerned and ask questions about, is it safe? Can I leave home? Especially in the early part of the pandemic around March. A lot of folks had questions about whether it was safe. What are we doing in the health center to keep people safe? And, we've always followed the CDC guidelines, and we ask people if they have any symptoms. Everyone is getting temperature checks before they come in. All of our staff have been wearing masks, and so we're doing everything we can to minimize potential transmission of the virus. But, again, like Liz mentioned, there's a lot of ways that this can be done differently, where a lot of folks don't need to even come into a health center to access the medications. We can ask a lot of the questions virtually via phone or through video, and prevent folks from having to expose themselves unnecessarily. And, right now, some places are doing better with viral transmission, but some projections are saying that things will go up in the future, and we don't know what's going to happen, whether it's this pandemic or some other pandemic. And so at the end of the day, whether it's a pandemic or another pandemic or something else, people should just get the care that they need and not have to do, extra things and jump through extra burdens and barriers and all of those things to get that care that they need. And unfortunately, they're having to do that at baseline and to a different extent during the pandemic.
Thank you. So I encourage our viewers to keep sending in their questions. We have a handful of them, which I'm going to start to get to soon. But I want to first steer the conversation a bit towards storytelling and how do we tell stories about abortion. So I'm going to ask each of you in terms of what you think is some of the most important things that we need to convey. I mean, obviously, ELIZA, you've already conveyed a lot in your film, but it's a vast subject, and there's a lot of different ways to tell the story. So I want to get input from each of you. And Lydia, I'd actually like to start with you. I mean, based upon your own personal experience, or those of your friends or people have gone through similar experiences, what do you think is the most important thing for storytellers to pay attention to in telling stories about reproductive health?
What I see mostly in stories that are being told is a lot of like the personal experience of the person experiencing that abortion. But in reality, it wasn't that big of a deal to me myself. Like I didn't really care about it at all as it was happening. And I never really thought back to it either. The most important part was like the conversations that were centered around it then that I had with other people, like my friends or my roommates or my family members, or even like new employees or colleagues that I had. I got to share my story with them. So like that transmission of story then from me to other people and those experiences we share through it is like what I see a lot missing from stories that are being told or presented.
Thank you. Eliza, your film centered on a young woman, a minor, and who was seeking an abortion. But we also know that and Liz, you can weigh in on this, I'm sure, that the average woman who gets an abortion is someone who's in their late 20s or to mid 30s and is already a mother, often has children, and is doing this for a whole host of reasons, but one of the most important of them often has to do with financial security and being able to provide, and these are responsible mothers who know that they don't want to enlarge in their family. So I'm just curious in terms of, if you were to make another movie than the brilliant one you already made, if there were other things that you wish you could have touched upon in your film but didn't have space for, or that you would like to see other filmmakers tackle.
I just think it's important that, people with uteruses kind of reclaim the narrative a bit, because I think it's been explored again, predominantly through a certain gaze, and the representation of that experience is so rarely told through people who actually go through it. So I think that's really important, obviously. And I agree, with Lydia in that so much of the representation of it focuses on this moral dilemma that I don't think people really struggle with. I think most people know in their hearts what's best for them. And yeah, I think just kind of steering away from the moral dilemma, steering away from, this sort of male exploration of the illegal abortion, which has been sort of done again and again. And then I think there's just room to normalize beyond that.
Yeah, and I would just follow up on that by saying the reasons anyone has an abortion, they shouldn't ever have to tell you. It's really no one's business. And I think and we talk about dramatizing abortion and putting it into the films, and it's why I loved your film, Eliza, so much, is that the drama and the narrative and the storytelling around getting an abortion is the act of trying to get an abortion. If you did a storyline about getting an abortion, I've had 3 abortions. They were not, personally for me, lucky for me, I'm not traumatized by abortion because I don't buy into this narrative that the anti-abortion movement wants to set up, right? That's where it all comes. If when they lay out this whole narrative for you about killing and yada yada, and it's not true, like, you're free to tell the stories you want, but to really tell the stories of access, of how it affects you trying to get one, and for what reasons, and to what end. The amount of time and energy that is spent legislatively, shaming, outside. We're in a pandemic, and there's never been more protesters outside of clinics, which is one of the things we haven't even talked about, which is patients are now faced with these unmasked marauders who, for the love of God, are literally holding up signs that say, "My body, my choice," and they don't want to wear a mask. And they're the same people outside of an abortion provider. It's like, I can't. But like, people are now exposed just trying to get care by people who are saying that they want their freedom and don't want it for somebody else. But so when telling the stories of abortion, don't try to make abortion dramatic. People often talk about these various ways that we've seen it on television, like, oh, on Scandal, and she had an abortion and she was having an early abortion and she's in like a surgical room wearing like a surgery hat and these Klieg lights. And it was like, the procedure doesn't need to be made dramatic, because it's really not dramatic. What's dramatic is the fact that there is some kind of entitlement to people's bodies, and that gets to be legislated, and that those pieces of legislation cause trauma and victimize people simply trying to get healthcare.
One of the things I most appreciate about your film, Eliza, and I don't think I'm ruining too much for anyone here, is one of the few times you really see your protagonist smile is after the abortion. Eating fries with her friend in a diner, and this sense of relief. And then, the closing image is her traveling back home and able to close her eyes and sleep. This notion of relief, and I've visited a few abortion clinics and spoken to, the people that work there that say, I ask, what is the most common, feeling that people tend to have after the abortion? Relief. They said hands down. And I thought it was just wonderful how you portrayed that. I'm not the only fan. We have a comment from one of our viewers that says, this is for Eliza. Congratulations on having made a film on this topic that reached out beyond the converted. I have heard from numerous friends who are not in the movement about your film and how good it is. Thank you. And that's from a woman named Francine. I'm going to move on to some of the audience questions now. This is from someone named ELIZA or Elisa. We know that tens of thousands of people in the US are safely and successfully self-managing their own abortions outside the conventional medical system using pills obtained online through services like Aid Access or across the border in Mexico. And we know that millions of people safely self-manage abortions around the world each year. How can we get this story told, that people are safely taking control of their health in this way? And how can we normalize self-managed care as something that should be available to us in the U.S.? I mean, that's a pretty big question. I think, Dr. Kumar, you addressed some of this and some of the misconceptions that people have, but what do you think is the most important thing to convey when it comes to self-managed reproductive health?
Yeah, that's a great question. I mean, I think the starting point for that is to know that people will always need access to abortion. We know that throughout history, and we know that even more now. So whether it's accessing, abortion care through health centers, or it's sourcing your own medications and taking matters into your own hands, people are always going to need access to abortion. A lot of people, as a person asking the question mentioned, are accessing medications online. And that can be a very viable source of accessing what you need. What we found during the pandemic was a lot of those medications are manufactured in different parts of the world. And when different parts of the world shut down, it can make that access even more difficult. And so what's most important is making, access available closer to people, closer to where they live within their own communities, making sure that the care that we're providing, whether it's through healthcare professionals or otherwise, is more attuned to the way people want to receive that care, how they want to receive it, and as soon as they're ready to receive it. And self-managed abortion, I think, is a great tool for a lot of folks right now. It's not perfect. It's not regulated in all the ways that we may want it to be. And I'm not saying that it needs to be regulated, but I think at the end of this, it is an indication to me that we need to move further so that folks can get, again, the care that they need, when they want it, how they want it. And we need to have a wide variety of things for people to choose from that are all, based in evidence, that are based in science, and are safe for folks, and they can access, additional care if they need to, and if they don't, so be it.
Well, and I think in general, in terms of both film and television, you have not seen very many stories like Lydia's, very few that are self-managed. More often than not, it's dramatized as a procedure. So just seeing more of those stories to begin with might be of service. Another medical question for you, doctor. Which option is generally recommended by doctors, surgical or medical abortion? Is there a greater risk with one over the other?
Yeah, that's a really common question. A lot of folks will ask, again, seeing patients today, a couple of folks ask, should I do the procedure in clinic or should I take the medications? And I never recommend one over the other. As long as you qualify, it's really a personal choice about what's best for you. And some of the things that folks consider between what's typically called a surgical procedure, but we're calling it an in-clinic procedure because it's really not a surgery, versus a medication abortion, is that with the medication abortion, a lot of the process is done at home or wherever you may feel safe. Maybe that instead of home is a friend's house or somewhere else. And you tend to be in control of the process. So you can choose when you want to take the medications within a time frame. You can choose if you want to watch Hotel Rwanda or have some other TV thing on, or have your blanket with you, maybe have somebody over, a couple of people over, nobody over. You can walk around. You're really in control of that process. You can go to the bathroom when you need to. There's not medical folks around, so if that's intimidating or anxiety provoking for you to see people in white coats and nurses around, then you can avoid all of that. It's pretty effective and it's very safe. Same thing with an in-clinic procedure. It's very, very effective, just as safe, but you're in the care of a medical team. For some people, it's the opposite, where they feel safer seeing people in scrubs and white coats and whatever else they may be wearing, and being in their care. A lot of people like to know that they are done with the procedure, and if there were a very rare complication, that if they were in a clinic or in a health center, that they would be taken care of. And that just feels better to them. And so both are very, very safe. Both are very, very effective. It tends to be a personal choice about what's best for that person.
Thank you. We have a storytelling question from Nicole, and I'm going to direct this to both Liz and Eliza. The question is, how do we get more television series, all capital letters, made about reproductive health, abortion, and women's rights? Not just a token episode on an existing show. There doesn't seem to be much of an appetite from network cable outlets and streamers to really delve into the subject because they don't want to alienate, quote, middle America and the Christian right. Liz, I'm sure you have a lot to say about this. I definitely want to hear the answer to this question because I'm currently working on a project where this subject is front and center. And I would also love to hear, Eliza, if you faced, what sort of challenges you faced in getting your film made. But let's start with you, Liz.
Well, I mean, it goes back a little bit to the first question you asked for people, like, how do we talk about this outside of our, already like-minded people? And already like-minded people aren't talking about abortion at all. When you look at network news coverage of abortion, like 0.3% of network news coverage consistently in the past 5 years has had abortion coverage, and it's the #1 legislated thing in our nation when it comes to what is happening. I think that there's still stigma around it. I think somebody's been doing a documentary on us being out on the road for 3 years and trying to get it sold right now, and distribution has been constantly things like, can you expand it to something else? Are men gonna really care about this? And the truth be told, part of the destigmatizing around all of this is people need to understand the human rights aspect of what it means to talk about abortion. Abortion affects everyone. If you are a cis guy whose girlfriend paid for her abortion, paid for birth control the whole time, you both got to achieve your dreams because there wasn't an unintended pregnancy that derailed either of you, you benefited from abortion. People benefit constantly from birth control and abortion, and it's still lobbed into this women's issue sort of category when it's an experiential thing that we all do and live and be in. I almost feel like some brave funder needs to fund a series on the front end so they can roll it out to Netflix without any question of how is this going to play, to see how it will play. Because it would be, I think, really, really great if you had a really great series that centered around something that had to do with abortion and reproductive care, to show that it is a topic that everybody wants, instead of having the few decide that it's a subject that's too risky for middle America. You want to know what? Middle America can handle it. They're not snowflakes. I'm from Minnesota. I can tell you that.
Missouri here. We got Indiana.
Yes, middle America wants this.
Eliza, what sort of challenges did you face, if any, in making your film?
Yeah, I think, I heard a lot of questions about whether or not it should be a documentary. And that was really kind of a shocking binary way about thinking about it, about the issues of the film. And I heard a lot of offensive, kind of ignorant feedback also at the same time. I pitched the film to a company in Hollywood that does focus on issues, and they told me that it didn't feel right because they were looking for more global issues like water. It's it's really fascinating that people don't think that these issues are global issues. I don't know. I give up. That's what I thought in that meeting when I thought I had found the perfect company to work with. So yeah, I faced a lot of challenges and also found a lot of support, in making the movie and getting the movie made. And yeah, I think it's all about, finding the right partners who, understand the significance of the work that you're making.
Here's another storytelling question, this one from Tricia. As someone who works as a storyteller, one of the biggest conflicts we face is balancing the need to bring attention to some of these subject stories, while also wanting to protect these people who are usually not public figures from an audience that can be extremely hostile. How do we walk that line? Now, I could imagine, I'm not sure if Tricia is referring to documentary storytelling or telling the true story of, but certainly, ELIZA, I mean, well, I'm sure you did a lot of research, you fictionalized, so you weren't necessarily drawing attention to any specific person or organization.
No, and because of confidentiality, protection, I never spoke with patients, and I relied more on talking to providers and getting their perspective, and talking to social workers and nurses, and through that, trying to find an original voice for a character. But I wasn't exploring any one individual's personal journey.
Thank you. This is a question about advocacy and activism, and so I'm going to direct this one at Liz. This is from someone named Susan. How effective a strategy is it to encourage people to donate to Planned Parenthood or NARAL in the name of some right-wing opponent, such as Mike Pence? Do you think there's a risk of trivializing abortion? As a person who has had an abortion and for whom it was an agonizing decision, I prefer asking people to donate because that's what they should do. So I am uncomfortable with this strategy.
I would say there's many different strategies, just like there's many different abortion experiences. And I feel like how you raise awareness, different tones and ways will get different kinds of people motivated. Don't look at it as your own experience being trivialized. Look at it as there's many different ways that people are raising awareness and destigmatizing what abortion looks like. And so I feel like it can be really effective because a lot of these people can't help but talk about themselves, and they would, like, if they find out that they were, there's this pastor named Greg Locke who's an anti-Planned Parenthood zealot, and a bunch of people donated in his name, and he went on his website and he was like, embarrassed himself, and then put the video he made embarrassing himself out onto social media, and then people glommed onto it and they were like, look at this guy, and then Planned Parenthood got even more money. And so I think that you do what you feel is right for you and how you want to promote the advocacy you like. But I think that don't necessarily think that there should only be one camp but several, and then you just like flourish in the lane that you feel right in and that feels good for your own experience.
Thank you. The hour has flown by. We're going to go a little bit over because I want to try to barrel through these last few questions. We always try to get to everyone's questions, but this is a little bit of a speed round. Now, there's a couple that have to do with medication abortion. One is asking, it's simply, how about mailing pills? And I think another question that sort of dovetails with that is, are there specific strategies we can use during COVID to support the fact that medication abortion is a self-managed procedure and the pills are so safe and effective, it should be over the counter? How can we change the narrative from early abortions being dangerous and difficult to easy and safe? So, I mean, Dr. Kumar, is the mailing of pills something that's possible? And what are we facing in terms of over-the-counter challenges?
Yeah, so we're definitely not there yet, at least from any licensed health center where you can get pills mailed to you. Part of the problem with medication abortion in our country is that 20 years ago, when the FDA approved the medication, they required that it be dispensed within the health center. So people still have to show up to a health center and have that medication dispensed, unless you're accessing them through websites through other countries. which can be mailed to you, but it's technically not legal, even though people do access that. And so we're not there yet, but after decades of the medication being approved and millions of people using the medication, we know that it's extremely safe, it's extremely effective, and so many people are able to use it and would qualify for it. So it's definitely a direction that would be great for people so that they can access the care that they need, but we're simply not there yet.
Thank you. This I think is a question for Liz. Can a federal law override these state-by-state restrictions? And certainly Supreme Court has weighed in on these issues in the past. And I don't know if with our current Senate and White House, if any law is going to be overriding state laws, but what efforts are out there and what is possible in terms of—
Well, I mean, I think you run into all kinds of elections matters situations here, right? So Roe v. Wade is technically the law of the land, right? But where Bobbitt practices in Texas, they don't adhere to all the tenets of Roe v. Wade, because you need to have states' attorneys general who will challenge legislation that comes through or won't take on a lawsuit against the law. And so as we work our ways through the courts and as we look at how laws matter, I think that there is federal law that has stronger abortion laws than how state by state goes. There was a Supreme Court case after Roe v. Wade called Planned Parenthood v. Casey, which allowed states to modify legislation around abortion, but they couldn't. But the laws couldn't provide an undue burden. But they never sort of defined what undue burden was. And 4 years ago, in the Whole Women's Health v. Hellerstedt case, we challenged and won a lot of those undue burdens. But now we have a court system that has been increasingly packed with anti-abortion judges who have literally brought laws that were struck down by the Supreme Court back through the court system and reheard them again. And we just had a case like that in Louisiana that we're waiting to hear on. It will hear in June, that could really affect how abortion provision happens by whether or not an admitting privilege can be issued to a doctor that provides abortion, even though SCOTUS ruled that that was unconstitutional and an undue burden nary 4 years ago. The exact same thing went to the Supreme Court, and now they're deciding on it. And the second part of that I think is something that we all need to be thinking about is the other part of this, what the justices just heard, is whether or not clinics have standing to sue on behalf of their patients. And that's a really important thing, because Planned Parenthoods and independent providers have for years been suing on behalf of patients, because if a pregnant person is suing because they need an abortion and they can't access that abortion, and it takes about 3 years for a case to go through the court system, we all know that pregnancy is 9 months, and you do that math and it doesn't work. And so clinics have been fighting diligently on behalf of their patients forever, and the Supreme Court is also going to rule to see whether or not if that's going to remain the case and if they still have standing to do so. So we're in a legislative kind of shit heap, to put it very eloquently, of how things play out. So federal, state, court system, and then there's the Department of Health and Human Services that can put in so many regulations that don't even go through any kind of legislative body, like the Title X funding. That is, it's a lot to learn and a lot of stuff to fight.
Bottom line, though, is that if people want to see change, they got to vote for the people that they think will institute change.
And you've got to be a face out front, too. It's not enough to just be passively pro-choice or say you're mad or say vote one way. You have to vote, and you have to be a face that says this issue matters to me. And if you don't believe in this, you do not get my vote, just like any other issue.
So we've gotten through all the audience questions, and I want to do a quick round robin question here. Obviously, this is a vast subject, and we're only able to cover so much in an hour. We've covered a lot, but this is your chance for all of our panelists. If there are any additional resources, whether it's a website a portrayal of reproductive health in a movie. We already know about ELIZA's, a movie or television show, a novel, a poem, what have you. If there's people on social media that you think that we should follow for more ongoing information. Just a quick round robin here of any other resources that we should be thinking about. Let's start with you, Dr. Kumar.
When you mentioned novel, the first thing that came to my mind was a book called The Story of Jane, which is about a collective that started providing abortions underground when they weren't available. And I think when I read it 10 years ago when I was in medical school, I thought, well, that's in the past, that's never going to be in the future. But now that we're getting close to that time again, I think it's worth reading to know what happened in our past. And hopefully we don't get to that point again in the future, but it seems like something like that could be possible. So it's worth a read. It's called The Story of Jane.
Thank you. Lydia.
I guess as the child of immigrants to the US, what I saw a lot was abortion portrayed in foreign films and TV shows. One is Rita from Denmark, where my father's family is from Denmark and my mother came as refugee from Romania and Bulgaria. And so I think a lot of foreign places are producing media that portray abortion really, really well. I have a friend from Iraq who came to the US and was actually completely shocked that she couldn't just pick up medication abortion from her pharmacy. And so stories like that from immigrants and from refugees, I think are really missing in the media here because we do play such a large portion of what makes America. And so I think those stories need to get told too.
Thank you. ELIZA.
Let me see. If you haven't seen the documentary After Tiller, I recommend it.
Okay, great. And Liz.
I mean, I'll just shamelessly say, if you want to get active in many, many different ways, go to Abortion Access Front website. It's aafront.org. And we can put you to work in large and small ways. Also, I highly recommend watching Mrs. America because the rise of Phyllis Schlafly is as important to how we are at with abortion access and the Equal Rights Amendment as anything. And it gives a really good backstory that inspires you to read about the real life stuff. But it's a really good portrayal of the woman who sort of took abortion and LGBTQ rights and turned them into an issue when they weren't one before. And it's astounding.
Great, thanks. And I'll add to the list, there was a great doc, I think on HBO called 12th in Delaware.
Oh, great.
Independent clinic in a small town and the crisis pregnancy center right across the street from it, and how that community struggles with this conflict that we're facing as a nation. And it's I think really well done. I'm going to end here before I turn it back over to Kate with a comment from Heidi Lindelof, and she says, "Thank you all so very much for this discussion. As a proud board member for the Center for Reproductive Rights, I appreciate all of the angles you have shared on this panel. Obviously very familiar with Liz and ELIZA, whom I love. Was happy to hear also from Lydia and Bhavik. Let's all keep telling our stories." Here to that. Thank you for the kind words, Heidi, and thanks to all of our panelists for sharing your stories and so much important and necessary info with everyone that tuned in. And on behalf of the WGAE, another thanks to Hollywood Health and Society for bringing experts like this together and giving us access to the knowledge and power that we need in order to tell the stories that need to be told. Kate, do you want to help us sign off here?
Hi, yeah, thank you. Thank you, everyone. This was a fantastic discussion, and I have so many more comments, and we may just have to do another one. I just want to tell everybody quickly that we've put a ton of stuff in the chat, links to articles, to a tip sheet we have, a couple of tip sheets actually, one that's specific to this time during COVID-19, videos, all kinds of cool stuff for you to click on and read and watch, and we hope you will. Also, just want to let you know that once we sign off, we will, a survey will pop up and ask you what you felt about the discussion and the panelists. And we would love your feedback as we continue to develop these panels, this series once a week with the Writers Guild. So please fill out the survey and send it back. You'll also get emailed tomorrow about it. So if you don't do it today, that's fine. You'll get pestered tomorrow. Again, Hollywood Health and Society is here to help all writers and entertainment industry professionals learn about all kinds of issues around health and medicine and safety. We're free. We're working during this time. You can reach out to us with your questions or comments or anything that you would like help with in developing your scripts and storylines. And we're happy to connect you with experts like we've had tonight and many more. So thanks again to Bo for moderating and to our panel. You guys were amazing, and have a great rest of your evening. Take care.